So good evening, everyone. I am Emma Barksdale. I'm the Health and Human Services Chair for the Greenville chapter of the Links Incorporated and the Market Admin Director of Risk and Insurance for Bon Secours St. Francis Health System. I am so appreciative to the Greenville Links for sponsoring this educational COVID-19 update, along with our partners, Bon Secours St. Francis Health System, the Urban League of the Upstate, and Long Branch Baptist Church. Educational and awareness opportunities are two of the essential components the Greenville Links take pride in providing to our community. I am delighted to welcome each of you on behalf of the Greenville chapter of the Links as we all listen and learn how we as a community can overcome COVID-19 by joining together to learn about the vaccine and help others to receive the vaccine as soon as possible. At this time, it gives me great pleasure to introduce my friend and your friend, the distinguished Miss Rhonda Rawlings. Rhonda is the Neighborhood Engagement Director for Mills Community Ministry, the founder of Uplift Upstate, a community engagement social media initiative, and the community affairs host for Summit Media Greenville. Rhonda will serve as our moderator for this evening. She will introduce the medical professionals and our community leader, who will be your panelists for the hour. A big thank you to all of my friends and colleagues for sharing the latest information about COVID-19. And a huge thank you to all of you for joining us. Now, please welcome Rhonda Rawlings, our moderator. Thank you and enjoy the forum.
Good evening, everyone. So excited to be here tonight. And I was talking to someone the other day and on social media, just stressing the importance of us remaining vigilant and not becoming complacent as far as COVID is concerned. I know that so many people are tired of hearing about it. But I was saying just because we're tired of hearing about it and just because the governor says we don't need to wear a mask, we don't need to let our guard down. We need to do all that we can do for ourselves, in the best interest of ourselves, our family, and our community, because we are definitely all intertwined in this. And I apologize. I have a dog behind me that is making noise and I can't get him to stop. It's the wonder of live video. We have a distinguished panel tonight. I'm going to go down their bios as I introduce them all. First, I would like to welcome all of our panelists. We have Dr. Zellner with us. We have Dr. Ryan Brown. We have Brandy Giles with us today. Of course, we have Pastor Sean Dogan with us, and a nice shout out to Miss Emma Barksdale, who coordinated this event. So thankful to her. So right now, I'd like to welcome Dr. Zellner. She is a medical director of emergency services at Bon Secours St. Francis. And what I love about Dr. Zellner, among so many things, is that she describes herself as obsessed with COVID. And we need someone to give us that information. We need an obsessed COVID person to talk to us and give us the realities of what is happening today. So right now, you can see Dr. Zellner is already prepared. I'd like to welcome Dr. Dawn Zellner.
All right, there we go. All right, so I have a few slides just because I'm going to do some of the sort of current state of the statistics of COVID and the vaccine. All right, so in the United States, we've had over 588,000 deaths. That's approximately the population of Greenville. So it's hard to imagine that number, but imagine everybody in Greenville dying. And that's how many people in the United States have died of COVID. The good news is that 61% of us, of the adult population, has received at least one vaccine. And more than 50% of adults greater than 18 years old are fully vaccinated. The statistics for race and demographics are that whites make up about 61% of the vaccinations, Blacks 8.9, and Hispanics 13.9. And when you compare that to the population, there's about 60% white people in America, 12.5% Black people, and 18.5% Hispanic people. So for a multitude of reasons, we're lagging in our minority community, and I think we'll speak to that later. And the people that are dying of this disease, most of them are greater than 65. If you're 50 to 65, it's about 15%, especially if you have a comorbid condition. Less than 50, only about 5% of people die. But death is not the only thing that happens with COVID. So, and I'll talk to that in a little bit. Greenville County, we have the breakdown of the demographics. But our vaccination rate compared to just America is a little bit lower. So we have fully vaccinated the 65 plus population at 72%. But the vaccination rate for the whole of the county is only about 33%. So, and this is the breakdown of African Americans and Hispanics have only received about 11% and 7%. And again, in the county, our numbers are lagging behind. And men, the other thing I just want to point out here is that men are more likely to die of COVID than women. And if you have comorbid conditions, you're more likely to die. So just to cover some facts versus fiction of COVID-19, the myth that's been going around social media, I guess, is that it will affect a woman's fertility. That's not true. During the study, 23 women that were in the Pfizer study became pregnant. There was one miscarriage, and that was a patient who received the placebo, so they didn't even get the vaccine. And COVID-19 impacts pregnancy. So the infection, not the vaccination, can impact pregnancy and cause early birth or preterm labor. And the American College of Gynecology and Obstetrics recommends vaccination in pregnancy and breastfeeding. The second myth, I don't need a vaccine if I've been infected. And that's not true at all. The vaccine gives you better immunity than the immunity you get from an infection. It's probably not as long lasting. And there have been multiple reports of people being reinfected. The vaccine was rushed, or that mRNA vaccines are brand new. And that again is not true. mRNA vaccines have been around since the 90s. They were developed to treat cancer. We just haven't used them as a vaccination in a large vaccination effort. And vaccines, yes, this came out faster than any other vaccine we've ever developed, but that's because we invested billions of dollars into it. Lots of people had the disease so we could study it. There was huge effort by the big pharmaceutical companies to make the vaccine and by the government. And so when you get a bunch of people and a bunch of money together, you can accomplish a lot of things pretty quickly. And the vaccine, what we have found is the vaccine side effects are typically mild and well tolerated. And with all vaccines, adverse events usually occur within 6 weeks. So the idea that we don't know what's going to happen to us 5, 6, 10 years down the road is not really something that we associate with vaccinations. Vaccination are the safest things we have in medicine. We prescribe medicines that have lots of side effects, and vaccines are by far one of the safest. The vaccine can cause COVID-19 disease, and that's absolutely untrue. It's not possible. They take just a little snippet of the virus to make the vaccine. And so when you do that, it can't replicate. So the little portion, the little code in the virus that tells it how to make more virus, it's not there in the vaccine. You're just making a small piece of the virus that your cells get the protein, and then your immune system attacks that protein, not the virus itself. This is the same as true with the flu vaccine. You don't get the flu from the flu vaccine. What you get is a day or two of body aches and fever from your immune system working. It's just like when your kids get vaccinated, you get your kids measles, mumps, and rubella vaccination. You don't see kids breaking out in measles, but they do get fevers afterwards. Again, the vaccine is dangerous. The adverse events have, the majority of them have been mild, and we've vaccinated over 130 million people now. There is an incidence of anaphylaxis or allergic reaction that can be severe. That's about 2 to 5 in a million. And it's more common in people who have had allergic reactions before. There was recently the hold on the J&J vaccine, the one-time dose vaccine, because of blood clots. And there is probably an association with that. Again, it's incredibly rare. It's less than 10 in a million. It is more common in women who are less than, that's my time, less than 50. Sorry. And so if you're a female less than 50, you may want to think about a different vaccination. The vaccine enters your cells and changes your DNA. It can't merge with DNA. It only enters local cells, and those cells die. It doesn't go into your bloodstream. The reason that the vaccine has to be kept so cold is because it's very fragile. And the vaccine was developed or contains controversial substances. And again, the vaccines were not developed using fetal tissue, and they don't contain implants, microchips, or tracking devices. Your phone does. Why did I get vaccinated? And why did I get my husband vaccinated? And why will I get my 8-year-old and my 2 5-year-olds vaccinated as soon as I can? Because I've read the studies and I understand the science, and the science is good and they're safe and effective. And 130 million people have proven that. I want to protect my community. I'm not in the age group that's likely to die from COVID, but my husband's parents who live down the street are. And the people I take care of and the people I work with, some of those people are at risk of dying from COVID. So I want to protect my community. I'm also really excited about not having to wear a mask every time I go outside, and I feel safe not wearing a mask because I've been vaccinated, and that has been a huge relief for me. And long COVID. So long COVID is another big, huge reason to get vaccinated. Just because you won't die of the vaccine or you're not in that age group, or die of the disease, but and you're not in the age group, long COVID is serious. It's affecting about 30% of people who get infected, even with mild infections. And it ranges from, it can cause coma in very sick people. It can cause heart problems in very sick people. But a lot of people are experiencing chronic diarrhea. They can't taste or smell as well as they used to for months and months and months. They get short of breath. They have fast heart rates every time they move around. They get chronic fatigue. They get what's called COVID fog, where they can't think very well. So long COVID is all viruses can cause some form of this, just not in the huge percentage that we've seen with COVID. And I don't want this to affect me for the rest of my life. So I chose to get vaccinated, and I hope you do too. And that's all I have. I did better this time. Only 7 slides, or only 3 slides instead of 100.
Everyone, I can't turn my video on. It says the host has turned it off. Okay, there we go. Thank you so much, Dr. Zellner, for that. I hope you don't mind. I screenshot your slide because so many of you are the queen of the myth busters because I hear so many people talking about certain things. Like you said, I don't need to get vaccinated because I've already had COVID. I've heard that so many times. It goes into your DNA. It was developed too quickly. So many things that people say. Now I have I'll just pull out your file, go down. But thank you so much for that. One of the questions I did get asked by someone is if a woman is breastfeeding, can they get the vaccine?
So ACOG, the American College of Obstetrics and Gynecology, has recommended that if you are breastfeeding or pregnant, that you get vaccinated. The best way to keep baby safe is to keep mom safe. And they've done studies on the animal studies that we typically use to decide whether or not we can give a medication to a pregnant or breastfeeding woman have shown that it's safe in pregnancy. And so your OB doctor is going to recommend that you get it. And I recommend that too, because I'm going to follow their guidelines.
Thank you so much. Next, I'd like to introduce Dr. Ryan Brown. Dr. Brown is a native of Orangeburg, South Carolina. He earned his bachelor's degree in biology from South Carolina State University. He also attended the University of Louisville for medical school, and he's currently employed with St. Francis Hospital as an emergency physician. So really excited for Dr. Brown to take the microphone. He's going to talk about why he decided to be the first to be vaccinated at Bon Secours. How did you feel after the vaccine, and so many different things. So Dr. Brown?
Hey, good evening. I guess I'm going to somewhat piggyback on what some of Dawn's explanations for why she's kind of got vaccinated in the same kind of macro reasons. On a smaller scale, yes, for protection of myself, my family, the people close to me, that's really important. COVID infection has, made the years and days and months and weeks longer, but make it even more longer, particularly when you're afraid or have the potential to not come in contact with the people you love. So one of my personal reasons was my parents are both over 65, and with the year of COVID, I could probably count on my hand the number of times I probably had hugged and kissed my mom. So that really had affected me and was a driving reason for me to want to get vaccinated, because, the ones you love are the people you don't want to hurt. I'm luckily in an age group that less likely to have, significant or terrible side effects from COVID. But a personal decision for me was to get vaccinated so I had the ability not to harm the ones that I love the most. On a macro level, this is a public health problem. COVID-19 is something that affects everyone in the public. So you kind of may have to make a personal decision. And I made the personal decision to do what's best for the public and have myself or take myself out of the pool of people who could potentially infect others. That's just on your day-to-day context. You never know who you're going to come in contact with, whether this person may look well, but may have a new diagnosis of cancer or some type of immunosuppressive medical problem that you come in contact on a day-to-day basis that, although you may do well, the person next to you may have a bad outcome. So why I chose to be one of the first vaccinated and have it documented was, part of kind of what I felt was my, duty as a public health advocate. So yes, I wanted potentially to be seen, and as an African-American face, to be seen, to be vaccinated, because I do trust the science and trust the people behind the science of the vaccines that have been produced. I myself received the Pfizer vaccine. I got my first dose on the 16th of December, 2020. And I guess I'll call myself special in that I did not have any significant side effects at all from my first dose or my second dose. And I think I've probably told this story multiple times now that both times after receiving my vaccine, I went straight into work. So potentially a mind over matter thing. And I do work a lot. So most of those days I was working after receiving the vaccine. So maybe a little bit of soreness, maybe I moved my right arm a little bit and felt sore, but no significant side effects for myself. So I count myself lucky that some people have been told me that they kind of experienced the normal side effects to be expected, headache, malaise, some fevers, fatigue. But the point of that being that those effects or potential side effects are very, very minuscule in the sense of the potential for, significant severity or severe disease. Back to what I was saying is like being an African American. I do think that part of the problem, or as Don kind of talked about, as far as, there's a lot of hesitancy within the African American community to receive the vaccine. And it's a compound issue. It has historical significance, socioeconomic significance. But part of what I feel may potentially be a help is, the optics piece. So being able to see faces who look like you, who you may perceive or have or feel as a trusted source, is somewhat as an outlet. I think, part of that is related to distrust. But, that's why I'm doing forums like this, to put myself, out in the public as someone is saying, like, yes, I do trust the science. I did take the vaccine. I'm vaccinating my family. My wife has been vaccinated. As soon as my child is able to get a vaccine, she will get one as well, too, because I trust the science. I trust the people behind the science. And although the world isn't perfect, and I understand fears are there, but you got to kind of balance your fear with appropriate knowledge. And so I'm here to try to help, possibly combat some misinformation as well, too. But, I think us as all medical professionals want to be here as good public health advocates. And because we want people to continue to do well as things seem to somewhat get better. And, we don't want to suffer or lag behind or all get COVID fatigue and keep ourselves as safe as we can because the pandemic is not left.
Thank you so much, Dr. Brown. That was really great information. And I'm glad you brought up COVID fatigue, because I believe that so many people are sort of getting lax with everything and feeling, a lot of people, because they have their vaccine and because a lot more people are going out feeling like they don't have to wear a mask. They think that, we're out of the woods, and that's just not the case. Do you find that as well?
Oh, yes. I was just telling my wife probably about 2 weekends ago. I met with some friends of mine from high school. We had dinner at a restaurant. It was in a private room, but I was just telling her that was my first time being out in a public atmosphere without a mask. And I told her, I was like, this feels so weird. And even though we were in a private room, I was like, it's been, over a year since I've been in a public setting like this. But that same token, it was people in the more general rooms and no one had a mask on. And I don't know how I feel about that, to be honest, because, we know what the vaccine rates of Greenville are, even at best, and that room wasn't filled with people over 65. At best, 70% of the population that, probably looking more between 40 and 50%. So there's still a large majority of the population that isn't vaccinated and have the potential to, contract the virus that could, offer significant long-term mortality and morbidity. So, I kind of have mixed feelings about it too. I still want people to do the right thing. And I think it's always okay to err on the side of caution.
I definitely agree. So I definitely keep my mask with me, and I use it, at my discretion. So really great information. Right now, I'm really excited to introduce, he's my pastor and so many other people's pastors too, but I always like to say he's my pastor. Pastor Sean Dogan is on with us. He's the pastor of Long Branch Baptist Church. He's also leading the charge at the Urban League of the Upstate. So we're so thankful for his service on so many different levels. He is also on the board of my new organization that I'm working with, Mill Community Ministries. So I'd like to talk to Pastor Dogan because, so sometimes, sometimes so many people will listen to their pastor even before they listen to their doctor. And so really want to give Pastor Dogan the floor to talk about how he encourages his church members and friends and his thoughts on how things are going right now as far as the COVID-19 situation and the vaccine situation. Do we open church back up? Are you comfortable? So just talk to us a little bit, Pastor Dogan, about your thoughts on where we are right now in terms of everything that's going on.
Well, thank you so much, Ms. Rhonda, and to the rest of the panelists. Thank you for all of the great information that you're giving to our community. And thanks to Ms. Barksdale for inviting me to be a part of this platform as well. So yes, I mean, March 15th of 2020 was the last time that we had in-person full worship. We are at 3 morning services, 1,200 people a Sunday, and going down to preaching to a camera with a little red dot on it has definitely changed our natural flow. But there's a reason why that flow was changed. And we can't forget that. And so I think, a lot of times we soon forget just because things are opening back up or people are moving around more. It's because, the thought is that if you take the vaccine, then things can get back to normal or more of a normal. If you don't, you can't just expect for the virus just to disappear and things get back to normal. So there has to be an action that's taken. One of my favorite scriptures when it comes to health is that an epistle of John that says that, I hope that you are in good health as your soul prospers. And it really talks about not only the spiritual part, but also our physical part. Doing the things that we need to do to take care of our bodies, doing the things that we need to do to make sure that our bodies are the temple that God has created them to be. And so therefore, it's not just about just a vaccine, but it is taking care of all of the other things that we would normally talk about, watching our weight, making sure that we are eating balanced meals, making sure that we are putting good things in our bodies, stopping or quitting smoking, those things that we already know. And what we have seen in the past 14, 15 months is that the coronavirus has really just magnified the lack of taking care of our bodies. And so, part of me, says, yes, I'm ready for everyone to come back. I miss everyone. But the other part of me says, if we're not taking the precautions that we need to take, it is better for us to stay in the state that we are in until people take the proper precautions. I am so grateful for our frontline workers. I'm so grateful for our medical personnel. I'm so grateful for the advice that they give us. My thing is this: if my doctor can talk to me about hypertension and I listen, if my doctor can talk to me about diabetes and I listen, if my doctor can talk to me about what a healthy lifestyle is and I listen, maybe I ought to listen when my doctor tells me about the vaccine as well. So we can't pick and choose the parts that we want to listen to. We have to have a trusted source and know that that trusted source is doing the research that they are not only called to do, but they're professionals in that particular calling as well. So I hope that people will go out and take the vaccine, and Bon Secours is definitely making great strides and making that happen. And I hope that we can get the message to the community and convince a lot of people to participate in the vaccination clinics.
Awesome. Thank you so much, Pastor Dogan. I can definitely attest to the fact that that Pastor Dogan is serious about our physical and spiritual health at Long Branch. I remember one Sunday, I don't remember which Sunday it was, but he had us all up and exercising before the sermon. So definitely serious about mind, body, and spirit. So thank you so much for that, Pastor Dogan. So there was something else I wanted to say. Do you find that a lot of your congregants come to you with questions about your thoughts on the vaccine? Because as I said or so many people look to clergy and they look to their spiritual leaders before they even will listen to what the doctors say.
Absolutely. When the vaccine first came out, I got countless questions. And, you know, and the only thing that I could say was get educated about it, talk to your medical professional and your healthcare provider. But also make sure that you're not just talking to family and friends about what they suspect or what they're guessing at. Talk to people who know. You know, Rhonda, I have to say, and I didn't mention this earlier, but I have to mention it, that, you know, I was keeping up with the number of gravesides and funerals that I was preaching just from March until August. I stopped at 45. Wow. I stopped at 45 because at 45, I thought to myself, this is not good for my mental health to talk about the number of deaths. I've seen and witnessed and heard of the suffering. And even though Dr. Zellner or Dr. Brown has not yet talked about just the suffering that people went through and are going through, I got to hear it. And I was not able to go and be by bedsides. I was not able to go or send people to care and pray and be there for people, you know, with their final hours. Neither were family members. And so it's the most horrific thing that I've ever experienced in the last year. Dying alone is not your chosen method to die. Neither is it for families. And the results of this, I believe we're going to be dealing with for years to come. At Lone Branch, we have taken it so seriously that even with bereavement and with grief, we've not only set up grief support groups, but we have also we have on retainer professionals that are, you know, professionals in grief counseling and bereavement. That's just how serious we have seen this last year to be. That, you know, praying is great and it's wonderful, but we've had to put some really we've had to make some tough decisions and to put some dollars and investment behind just getting people help to deal with something that's so natural as death.
Wow. And I'm so glad you brought that up as well, because there is so much grief right now. You know, I have a really good friend who lost her husband to COVID, and it was very quick. He was diagnosed on a Saturday and felt fine, and he passed away on a Wednesday, and without even being hospitalized. But the grief that she is going through right now. So I think we really have to keep all of that in mind, and it's hard, but we have to keep all of that in mind as we look at how we're going to move forward. We don't want to just take a moment of, because we're more comfortable in a certain way, and forget about how serious the situation is. So thank you for bringing that up. Now I'd like to introduce Ms. Brandy Giles. She is a nurse practitioner. She is a manager of the COVID vaccination site and COVID testing for Bon Secours. She did her undergrad and graduate at Clemson University, and she's currently a doctoral student at MUSC. I was going to call you doctor. Maybe that's the sign.
Not yet. Not yet. So thank you, Rhonda. I want to speak on how we have made the vaccine so much more accessible. In the beginning, it was very difficult. We had a lot of difficulty, maintaining supply to the demand. And so that's no longer the case. It's very readily accessible. Our current clinic is at the downtown campus in the Bernadine Center, and we're there. Tomorrow we'll be there 8 to 7, but we'll accept walk-ins 8 to 6. After that, we'll be there from 8 to 4 with walk-ins 8 to 3. You can make an appointment online. You can call our call center. You can make an appointment through MyChart, or like I said, you can just walk in. We do give the Pfizer vaccine, and Pfizer is right now the only one that is authorized for use in ages 12 and over. So that covers our 12 to 17-year-olds that the other 2 vaccines don't cover quite yet. So we'll welcome those 12 to 17-year-olds as well with a parent. We have, like I said, plenty of vaccine. We are doing a lot of community events. I know there's one tomorrow, not through us, but through DHEC. And we will be at the Swamp Rabbit Games this weekend. We have partnered with Legacy Early College and the Hispanic Alliance, and we'll be at Legacy Early College on June the 5th. This is our second event there. We have several other events planned, and so we're trying to take it out to the community so that it's easy to get to. I appreciate Dr. Zellner's work and taking care of some of the myths and hopefully some more adoption. The vaccine hesitancy will start to recede as we have more people vaccinated.
Thank you. And so you brought up a good point. So right now it is fairly easy to get your vaccine, whereas in the beginning, people were sort of hanging out at CVS or Walgreens or wherever, just hoping that there would be some left over. But so for people who even haven't received their first vaccine yet, it's still an easy process to get it now.
Absolutely.
Correct?
Super easy. Absolutely. It's super easy at this point. We were in the beginning, turning people away just because we didn't have the vaccine. We had to be really careful that we were following governmental guidelines, state guidelines as to who we were vaccinating. And that was heartbreaking for us that were there administering the vaccine, because we want everyone to get a vaccine, everyone who wants one. And so, and we want to help those who are unsure to make the right decision for them and to give them the correct information. But now we are, we're wide open. We're pretty much, you can walk in and get a vaccine anytime we're open. But again, and we're trying to take that out to the communities. We've got some more things in the works, and we'll keep everyone updated as we're able to.
Awesome. Thank you so much. And I'm going to ask Ms. Barksdale to come on towards the end and just give us information about tomorrow's vaccine clinic. So I'm really glad that we're not only talking about it today, but we have action items and information for people who want to go out and get the vaccine right now. So definitely that's a good sign. I should ask you, and I'm sorry if you've answered this, the vaccine is not yet open to everyone, right? There's still young children who are not able to get, correct? Correct. It's just 12 and over at this point. Pfizer is working with the FDA to get approval for those younger children, and even working on studies and efficacy and safety in even infants at this point. But right now we're 12 and over. Okay. Thank you so much. Once again, I'd like to ask Ms. Barksdale to come on towards the end and just give us more information about the vaccine clinic that will be held tomorrow. Wanted to check with our host to see if there were any questions coming through, and you guys can send that to me in the chat if there are. But I will open up the floor for questions right now so anyone can jump in. So one of the questions I think I hear a lot is, is it possible? Can you catch COVID after you receive the vaccine? Whether it be whether you just get the first vaccine, if you just get the first one, is it still possible for you to get COVID?
So especially after the first one, you're not fully immunized. So it is quite possible. We took care of someone the other day who had the vaccine 4 days prior, and when she came in, she was her oxygen levels were very, very low. They were 25%. Normal is 100. COVID weird because I've never seen a human be able to be awake with oxygen levels that low. But COVID, the way that it works, we've seen lower oxygen levels than we've ever seen, right, Ryan?
Right.
The vaccine is about 95% effective. So that means that 95 out of 100 people won't get infected if they get exposed to COVID. 5 people will. The risk of dying after infection or after getting disease after being vaccinated is still very low. I think it's about 1 in 500,000 are the numbers right now of dying or being hospitalized and dying. You can still get infected though. So you may not feel that you have the disease, like you may not have any symptoms, but you could have some infection. So this is why it's important that everybody get vaccinated, because if that person who is vaccinated has been exposed to COVID and they're not sick, but they have the virus in their nasal passages and they're around somebody who's unvaccinated, it is possible that they could give that to that person. Now, the risk is much, much lower. The amount of virus you're going to be shedding as opposed to what you would have when you are sick is much lower. Right now, one infected person who is unvaccinated can give COVID to 4 other people who are unvaccinated. And just do that math in your mind. But with the vaccine, it's probably a lot lower, but it's not impossible. So that's why it's not, when you talk about mask wearing, we're still going to be wearing our masks in the hospital. I still wear my mask when I go into crowded places. I do follow CDC recommendations and walk outside without my mask because it is very freeing for me right now. But in crowded places, I definitely am. And I still try to be around people who are vaccinated. So 95% is not 100. It's really high. It's really, really great. It's a great vaccine, but it's not 100. So.
Gotcha. And that was my next question, because the vaccine is not at 100%. So we still need to be diligent. So we hear a lot about, and this is for anyone, Dr. Brown, Brandy Giles, about the herd immunity. We'll feel more comfortable when we get to herd immunity. What exactly is that? Can you guys hear me okay?
I had a delay in mine.
Oh, can you hear me?
Yeah, I can hear you now. You said you're speaking about herd immunity.
Oh, yeah. I hear a lot of people say they'll feel more comfortable when we get to herd immunity. What exactly is?
So I guess this is the working thought that more people will potentially become immune to the disease, either through once more people have been infected with it, transmission of those antibodies received, so that the more the masses are, less to succumb to the disease. But I think the difficult part, or what the active part of what we're trying to promote, is people becoming vaccinated to promote herd immunity more than anything else. And that's the simple gist of it as well, too. It's a complicated thing. But I think what I don't want people to think is because other people are receiving the vaccine and other people have gotten sick, that they can't get sick as well, too. So what I'm just saying is get vaccinated. That's the best way of keeping your herd, your personal herd, immune more than anything else.
And so the herd will protect those people who can't get vaccinated too. So there are certain people who have certain diseases or who are at risk for anaphylaxis or who have cancer who can't be vaccinated. And we need to protect those people. So the herd is all vaccinated, so none of them can get the disease. So they can't give it to anyone else who can't get vaccinated for medical reasons. And you've got to get to a place that's high enough of vaccination to get rid of the virus being able to spread amongst people. So we think that's 75% or so. And like I said, Greenville County's at 33 right now.
Oh, wow. Okay. Because you hear a lot of people talking that the fall, maybe towards the fall, we'll be in herd immunity. But okay. So also, this vaccine is not the end as far as us needing to get a vaccine, correct? It could be some months down the line where we have to get, what would you call it, a booster shot?
I think that's unknown right now. So we don't know how long the immunity is going to last. Till the world is immune, we will still be living with COVID. We're a global community, so vaccination efforts worldwide are incredibly important. The Olympics is talking about the Olympics. Only 2% of Japanese people are vaccinated right now. That part is important, and then the booster part is about whether or not we have a variant that our vaccines don't work for. It's not exactly like the flu. COVID isn't, but I don't know if we're going to need a booster. I think that depends on how we behave, how we as the richest country in the world help vaccinate the population of the world, and what we find out about the lasting immunity moving forward. Flu, we get flu shots every year, but you don't have to get a measles, mumps, and rubella every year. And so we just don't know yet. But it's very easy to make a booster for with the mRNA vaccines. So if a variant comes out, I don't think all hope will be lost if something changes.
Okay. Now, a lot of seeing a question coming in. The question is about cancer patients. Should they consider the vaccine or not, or does it vary with certain types of cancer? That's questions open to anyone.
So what we're seeing.
Okay.
Go ahead, Dr. Brown.
And I think that person kind of answered that question on their own. Yes, I think it varies on one, the type of cancer that you have, and particularly secondly, the type of treatment that you're receiving for your cancer. So that's a very specific thing, and with that, I think it's definitely more important that you discuss that with your oncologist. Because, like I said, there's so many variables, particularly on the type of disease you have and the treatment that you're receiving. So that's a question that I think everyone specifically needs to ask their own oncologist about whether they should receive the vaccine.
What we're seeing in the clinic is, and with reports from oncology, is that they're encouraging it for most of their patients. And it's truthfully, like Dr. Brown said, dependent on the type of treatment they're receiving. There's a lot of chemotherapies and a lot of treatments that will cause a significant decrease in your immune response to anything. So those are patients that it's kind of borderline whether it would they would create enough of an immune response. But we're seeing a lot of oncology patients come through and with their oncologist encouraging it. So definitely a discussion you would want to have with an oncologist.
Thank you. From any of our panelists, is there anything tonight that we didn't cover that you would like to speak on regarding COVID, regarding the vaccine, the importance of it, mask wearing, anything that we didn't cover that you would love to get a message across about?
I would just like to say that long COVID is going to be an incredibly impactful on our health going forward for years, I suspect. And it is happening to young and healthy people. I have a PA who was out for 3 months because every time he stood up, his heart rate would go up to the 130s, 140s, and he would get very short of breath. He passed out several times. We had to sew him up in the department. And he is like 40 years old. Several of my nurses have gotten very sick with this same kind of symptomology and have had to be out of work. And the reason people are getting long COVID is multifactorial. We do not have a treatment for it yet. But even just minor things like, people lose their sense of taste and smell when they get sick, and then they don't get it back. And and they suffer a little bit. Just their overall well-being suffers because their favorite food is they can't taste it anymore, or everything tastes like burnt oranges. And I don't know how long that will last for them. It could be for forever. And these people had mild disease. They were not that sick. So dying from COVID is awful. Watching people die from COVID was horrific. Watching them die alone was horrific. When I got sick during COVID, not from COVID, but from something else, and had to go to the hospital, and I was fairly ill, and my own husband and my family couldn't come into the hospital because this was in April in 2020. And it was being surrounded by people I know in a familiar place. And it was one of the worst experiences of my life. And I can't imagine doing that as somebody who doesn't know the people around them taking care of them. And so this is the only way out that I see is the vaccination. And we have got to come together as a community to, and as members of a society to protect ourselves and protect each other. And I don't want to see anybody die anymore.
Definitely. I can definitely agree with you on that. And want to say thoughts and prayers to everyone who has been touched by this disease or who has lost someone to this disease and who is going through it. We are definitely keeping you in our prayers. I want to thank all of our panelists so much for being here. Dr. Dawn Zellner, Dr. Ryan Brown, nurse practitioner Brandy Giles, Pastor Sean Dogan, and like to call on Miss Emma Barksdale to talk to us about the vaccine clinic tomorrow and just to sign us off for the night. Also, thank you to Angie Moten and Matthew for their behind-the-scenes help, and to the Urban League for hosting us tonight. Ms. Barksdale?
Yes, and thank you so much, Rhonda, and thank all of my colleagues and friends. Y'all did a superb job, and I appreciate how you educated the community and educated myself as well. So a big thank you. And as Rhonda mentioned, and as Brandy talked about first, I feel like there are some people that we have reached tonight that probably want to get their shot tomorrow. And so Brandy mentioned you can come to Bon Secours St. Francis to the vaccine clinic tomorrow starting at 8:00. And also the Greenville Links are sponsoring a vaccine clinic tomorrow afternoon from 2 to 6. And it's going to be at the Kroc Center. And we have partnered with DHEC to do this for us. And the exciting thing, it's Friday evening, and I like pizza on Friday evening. So if you come to our vaccine clinic tomorrow afternoon, you will leave with a pizza, and you can feed whoever you like. And we also will have some prizes. And I don't know what all the prizes will be, but we will have a few gas cards because we know how expensive it is. So thank y'all so much. I appreciate all of you. And we look forward to getting the numbers increased in South Carolina like they are in some other states. So good night to everyone.